Hello everyone, my name is Lisa Peterson. I'm a senior analyst here on the preparedness team at ASTHO, and I want to thank you all for joining us on today's webinar, State Advocacy for MRC Units. With us today, I have two of our staff members here at ASTHO, Christopher Gould and Andrea Garcia, who work on federal government relations and state policy teams here at ASTHO. Just to let everyone know, to start the webinar, everyone will be in a listen-only mode, and following the presentations, we will open up the line for discussions and questions. During the meantime, if you do have any questions during the presentation, please feel free to use the chat function on the box on the side of the webinar. We will go ahead and get started. Again, as I said, our presenters today are Christopher Gould, who is our Director of Federal Government Relations here at ASTHO, and also Andrea Garcia, our Director of State Health Policy. And Chris, if you're ready, I will go ahead and turn the presentation over to you.
Okay, great. Thank you, and good day, everyone. During this section, I'm going to discuss my side of the shop, which is advocating for public health directly. I'm going to go through how we go about approaching lawmakers and the tips to make it easier. This can be applied on both the state and federal levels, although I'm, of course, more geared towards federal, so this may lean towards federal, but it can always be applied to state. You can use what I'm going to go over should you wish or are able to go through your position to talk to lawmakers, or just approaching them as, frankly, a concerned citizen and your right to petition. Later on, Andrea will also briefly highlight the issues around using federal dollars for advocacy. But in this, it's just going to be pretty much my world, kind of what we're seeing, best kind of practices, and potentially the future of where we're going, especially with what we deal with at ASTHO, which is funding for preparedness efforts. Next slide, please. So when it comes down to it, who do decision makers listen to? I mean, the answer is you. There is a growing misperception that elected officials no longer listen. But you can't fall into this trap. I worked on the Hill for 7 years, and people would say that to me all the time, that, it doesn't really matter if I come up and say anything, but it does, because if I don't know about it, then, my boss wouldn't know about it, and that's the way it applies on the state and federal levels. If you don't make noise about it, then those that do make noise will win the day, and if you don't make noise about it, then frankly people in those positions won't think it's important, so they won't think it's important enough to care about it. The one thing is, a lot of folks, don't even understand public health. They don't get it enough to put time and effort into it. Even if you explain what public health was, they still don't entirely get it. It's an ongoing process. We see this especially, as a clear example and correlation when you look at, for example, the CDC's budget over the past 4 or 5 years. I mean, we've seen it drop about $1.6 billion in budget authority. It's like a 23% drop in budget authority, over just that time period. So that's a clear indication that people still don't get public health, and frankly, not a lot of people are discussing public health. Next slide, please. And this is just another little tip that staff are important too. I know if you've ever been to the Hill, I know there's some staff in the states. They're young looking. You think that they won't take it seriously, but they will. And even if you don't think they do have the ear of the member. And frankly, staffers have a long memory. So if ever a staffer thinks that you don't think they're important enough, they can remember that, and they will remember that. And, a lot of staffers go on to be big things. I mean, when you look at even Representative Ryan, chair of the House Budget Committee and former VP candidate, he was one time a congressional staffer. So, it's always the caution of you never know who you're talking to and who that person, may later be in life. Next slide, please. So if you look at a potential role in advocacy, should you wish to go that route, you provide the subject matter expertise, and your other role would be develop relationships. I mean, that's the key, is to be the go-to person. and to proactively feed them information so they know what's going on and get a better sense of what public health does. And then also to use expertise to provide the impact. If you see legislation coming down that you don't like, you need to let people know. Being experts and constituents, you're likely to catch the attention of a legislator or a staffer. So, you want to make sure that they really want to reach out to you first. There's some groups that make a lot of noise. They may not necessarily have that expertise of public health. So you want to be sure that you're the go-to person for that to better explain and best explain the reason why these resources are important to continue to provide to public health. Next slide, please. So this is the one thing people always seem to struggle with, which is what should be discussed. Our message is if you go in and talk about, let's say you go to Capitol Hill and you talk about it nationally, you're going to put the staffer to sleep. You want to keep it, just like on the state level, you want to keep it local. They want to hear what's happening, whether it be, in their county, whether it be in their district, whether it be in their state. They want to hear everything local. They don't want to hear any big picture thing because, frankly, they don't care because they're elected in one area only. So you want to be sure to focus on that. So you also want to tell a story. You go in, if you have good stories about what, let's say, public health is doing, what preparedness is doing, you're going to get more of an audience to listen. You want to let them know the importance of state and federal funding, let them know the challenges and how some of those challenges may impede the work of public health, especially in times of disaster. And you want to point to specific things that have happened as to show how public health moved in. Again, you'd probably be amazed, or maybe not, frankly, given the current funding issues around public health, exactly how little people know about what public health is and does. So, there have been many times I've gone into Senate offices or House offices and have talked about public health and compare it to a potential, or a past disaster that have happened. And overall, at least before we started educating them, it was, sure, you know what, we support and like FEMA. It's like, well, so do we. But, on the public health side, they complement other agencies. And people seem to forget all across the board, whether it be this prescription drug abuse issue, they think it's all law enforcement. People seem to forget about the public health side. So that's the job is to keep informing them what public health is and does. And I think, you always want to approach folks, unless you know and have targeted in the state and federal level experts that get public health and are champions. I think you always want to approach folks with the thought that they do not understand what public health is. And be prepared to counter their notion that public health officials are simply, bureaucrats that sit in big buildings and tell people what they should or should not be doing. And, trust me, I've heard that before. I've heard, well, they sit there and say, I can't have big gulps. Well, that's not public health. I think that's also what hurts public health is to think that, that public health is just this group that creates a nanny state. So again, it's going in and just trying to educate them on exactly what public health is and how it benefits their constituents. I think that's the key. If they know it helps, they'd be more inclined to step up and do something. Next slide, please. So the other key thing that we do is, of course, targeting the right players. So, if you're going to see somebody, it's good to know what committees they sit on, because a lot of what they're able to do depends on the committees they sit on. So you want to research it and make sure they're on different, either state or federal authorizing committees, or when you look at the appropriations committee, that's a big one because the power of the purse drives everything else. So you want to make sure you research these folks, research if they've talked about public health, research if they're a potential friend to public health, and then kind of tailor a message around that. And frankly, I think that we're entering in this new world of federal funding, this new world of this fiscal environment that seems to, I mean, it's stabilized for 2 years, but, we see potential collapse moving in out years. So I think we have to also be aware that targets may be moving. What we're seeing is the potential for more of a shift to the state level from federal. I've heard from several different sources the notion that states should be pitching in more for public health, and I've specifically heard it around preparedness efforts. And they have the idea that states are doing a lot better in getting into the black. They're digging into property values. They're digging into home sales. So they look at that and they say, well, this state's doing pretty well. So I think it's the responsible thing for the state to do to pitch in, because we know preparedness dollars, it's upwards of 90% come from federal. So they're trying to shift the burden off of them onto states. So, our notion to that is, well, you know what, that's fine, but, granted, let's say a state is in the black, well in the black. Well, they've got some rebuilding to do, and guess what? Public health is pretty far down the line. I mean, you're talking about education, infrastructure with transportation. So, that's the other thing is they think that, well, states can pick this up, but they can't. And so I think there's going to be more burden potentially put on states for funding. So that's something else I think to keep an eye on moving into the future, something that I don't think we really saw would happen this quickly, but the Fed seem to think that it potentially should be happening. Next slide, please. So, the question is when to educate. It is common. It's common to think that decision makers put two and two together when a major event happens. So, when there are disasters like the Joplin tornado, flooding in Colorado and other states, even the Boston bombing and West Texas fertilizer plant explosion, or, frankly, the other numerous events that we've seen so far and that, we probably will continue to see this season and into this summer, lawmakers do not think about public health and the need to maintain a strong preparedness infrastructure. When they see these events happening, again, public health is probably the last thing they're thinking about. They don't realize that, when there are floods, that could put entire nursing homes and long-term care homes in jeopardy, that public health has to move in to move those people. Or when, in the Joplin tornado, when the hospital itself was hit by the tornado, you have injured on the ground plus the hospital is damaged, they don't seem to realize, well, who takes those people and puts them other places? Who moves in to see if their bed's open? Who draws in ambulances from other states? It's these things that they have no idea. And I think that, a lot of times in public health, we kind of take it for granted that they know, but they don't. And so it's almost like you have to take advantage. I know it sounds bad, but you have to kind of take advantage of a disaster when it happens. And that's the issue, is they don't. Next slide, please. So you have to kind of paint the picture for them. And this is when we have to remind them of what public health does before, during, and after an emergency or a major event. I know things are busy during a disaster, but it is vital at some point after things have calmed down to educate them on what public health's role was during the response. So again, it's like it's building from square one. I think you'd be shocked that when I would go in and talk about, let's say, Joplin, or talk about these major events we've seen in the past 3 years, little do they know that public health was even at the table. Little do they know that during the West Texas fertilizer explosion, that the state health official, Dr. Lakey, was the first public health official on scene and coordinating as he was there. They don't realize that public health is that hands-on, and it's just this. I think it's a minor bump that we have to again fight, because all these other groups are fighting for funding and fighting for authorizations, and I think that with all the good public health does, I think our voice is louder. But we just have to, I think we've just got to start screaming over everyone else at this point. Next slide, please. So when you look at FEP and HPP and the funding history, so starting at a decent time of FY10, you see that, FEP has dropped slightly. Of course, when you look at the first appropriation, which was just about $1 billion, it's lost quite a bit. HPP continues to drop, and that seems to be a bigger concern for us. And the President's FY15 budget request for HPP is again $255 million. We've heard major concerns from ASPR on this, and as well as FEP. I mean, FEP now is down. The request is $617 million. So we continue to see erosion of preparedness funding, which isn't good. It's making a lot of folks in states nervous. And frankly, I mean, we've tempted to beat back the notion that you're just buying stuff. You're buying stuff with this. So how much stuff do you need? So we keep going and say it's not stuff. We need to keep training. We need to keep ongoing efforts. You don't buy police 500 guns, and when they come in, they pick them up and you send them out on the streets. I mean, you got to continually train these folks to keep people safe in disasters. And then again, you have to show this is what we did to save lives during disasters. So I think this is our biggest concern, and our recent snapshot of kind of the trend we see. So in looking forward, I think there are major concerns because moving into FY16, after the 15 process is over, the 15 process was a little more stabilized because of the budget agreement. Moving into 16, sequester again becomes a problem. Budget cuts still become a problem. There's issues where a lot of members of Congress are saying that NIH has taken a big cut, so we need to restore NIH. Granted, NIH does good things. However, it's always public health that seems to take the brunt of the transfer of dollars to NIH. So, our fear is we're fighting back potential, mega cuts in coming years of maybe even upwards of 15 to 20% to these core public health programs. So, again, I think it's imperative that we all talk about it. We all send, notes, letters, if there's opportunities to do op-eds, anything to kind of draw attention to the fact that with this withering infrastructure, it'll do major damage to our capacity to respond. And I think that's the key moving forward. So, that's my quick kind of snapshot of what we do on the federal level and kind of tips. But it's a long haul, and we keep fighting it. It's just I think we all need to kind of jump into the pit with everyone else to kind of scrap for the money that may or may not be there. So my next slide is just my contact information. So, feel free at any time to reach out for me if you want any clarification or any more information about anything I've talked about or potential issues that you might be hearing about coming up for federal funding or anything about the government in general. Feel free to reach out. Thanks.
Thanks, Chris. Now we will turn the floor over to Andrea Garcia, and she'll talk more about specifically state health policy. The floor is yours, Andrea.
Thank you, Lisa. I'm going to give you a brief overview of ASTHO's state health policy work today, and I'm hoping that some of the tools and resources that we have will be useful to you. So our state health policy team leads legislative and regulatory tracking across the states on priority public health issues, and we use this information to look at trends in state legislation and state law and to identify emerging issues. We provide guidance to the different ASTHO policy or program teams on policy issues, and we interface with a lot of state policy-oriented organizations, be it the health professional groups or the disease-specific groups, hearing from them what their priorities are, what they're taking a position on in the states. And then we also, one of our other major activities is supporting the State Health Agency Legislative Liaison Peer Network. Next slide. So I'm not sure how familiar you are with the legislative liaison. Some groups that I present to work with them all the time and know who they are, and other groups have no idea and ask me who their legislative liaison is in their agency. So this person or persons is the primary point of contact in the State Health Agency with the state legislatures, their staff, the governor's office, and other stakeholders. They're responsible for tracking the progress of public health-related legislation and other appropriation items in either the governor's or the State Health Agency's legislative package. They coordinate the review and the comment and the drafting of testimony. And it varies quite a bit in states. Some are registered lobbyists, and some are prohibited from lobbying and can only provide comment or feedback when asked to do so. Next slide. We bring the legislative liaisons together on conference calls every 6 weeks to talk about emerging issues and share information on strategies. And we also hold one in-person meeting per year, and that's usually in July. And that's time to share lessons learned from the current legislative session and to prepare on priority issues for the following legislative session. We have several resources that are available. In January, we put out a legislative perspectives document, which is the result of surveying the legislative liaisons and looking at pre-filed bills to determine what the major issues are going to be impacting public health and state health agencies in the upcoming year. And then we do an end-of-session legislative summary highlighting the trends that we saw across the states. We also have real-time legislative tracking, which I'm going to show you in a few slides. Next slide, Lisa. So I want to touch on restricted and permissible activity before showing you our legislative tracking. So ASTHO state health policy work is funded by CDC. So that means we don't take a position on anything at the state level. We are really restricted from engaging in any advocacy activities. Our work is solely around policy research, providing objective presentations of evidence, looking at the impact of specific policies, or helping to identify best practices and models. As state and local grantees, you have a little more flexibility than we do in terms of what is restricted and permissible, but then you'll see like direct advocacy for specific laws and encouraging calls to officials is also restricted. Next slide. This is a snapshot of our state health policy legislative tracking website. I wanted to show you the first screen, which gives you the list of all the various issues that we are tracking, and you'll see preparedness and the little red arrow. If you were to click on that blue plus sign next to preparedness, next slide, this will pop up and you'll see the issues that we are currently tracking on this topic. If you were to click on select state next to say volunteer health professionals, it would pull up a state map and then you could click on your state and see all the relevant bills. We're going to click on view all. Can we take the next slide? And this will show you volunteer health professionals as an example, where there is current legislation in the state. So if your state is blue on this map, then there is legislation under this topic. So the first one is Colorado. It shows you the bill number, the sponsor, the title, and the current status of the legislation. Next slide. So for advancing state health policy, I think a lot of what Chris said is really relevant here too. State legislatures are considering thousands of bills each session, and funding is limited, and they're really looking to address competing priorities, sometimes in a really limited amount of time, 30 or 60-day sessions. So those things that Chris mentioned are really the same here. Relationships are key, and don't assume that they understand your agency or the work that you're doing. And when you're meeting with them, provide interesting and concise education materials. Next slide. Chris talked about the need to highlight major events, and one way of thinking about this is the policy window and when that window is open. I think we've been talking about volunteer liability issues for years now. I know I came to ASTHO from the American Medical Association, where I was working in the Center for Public Health Preparedness and Disaster Response, and that was a big issue then, and that was many years ago. I think right now people aren't seeing this as a problem or don't know it's a problem, and there's not a lot of political will. I mean, we see there's only 6 related bills in the states this session. So things just really aren't moving on that issue. Next slide. I wanted to, before wrapping up, mention to you that we have a work group of public health lawyers, 8 state health agency legal counsel, and they're available to provide real-time interventions and advice on legal issues around emergencies. So if you have questions that come up around legal issues, this group is available to you to provide assistance. You can get in touch with me directly if you have a question that they could provide advice on. I would say some of the issues around volunteers are one of their priorities this year. So they're really looking at how they can provide guidance on those issues. Next slide. These are just a few resources if you want to look at our legislative tracking website or the materials on our public policy website. There are links available. And we also have emergency volunteer toolkit that touches on some of the legal issues for volunteers. And I'll stop there.
Great. Thank you so much, Andrea and Chris. I really do appreciate it. Now we would like to open the floor up.
The conference is no longer in listen-only mode.
For any questions that anyone may have, please feel free to go ahead and ask. Again, if you have any questions, please feel free to go ahead and ask. I do have a question for Andrea or Chris. From what you guys are seeing right now, what do you think is a topic that I think that people can go into to speak with their legislators that their legislators are really opening to hear about, specifically within preparedness? Is there anything that they're really looking forward to hearing and you see their eyes kind of open up and they nod their heads and are agreeing with it? Is there anything that the more stories that they would like to hear about or they're asking for?
I can quickly jump in. I think, for example, an example that I have when I brought up before the Boston bombing event, you know, it was all over the news that this one, especially this one particular ER doctor, said that it was a miracle, and he was amazed that they only lost 3 people, and those are the people closest to the bombs. And what he saw with the terrible injuries that came out of that there was not additional loss of life. And you know, that's what we tend to highlight to when we go in to talk to offices, to say that, you know, they were prepared. The way that thing moved, the way the machine was turned on, the way the alert went out and hospitals cleared the deck essentially and were prepared, the way the ambulances were lined up, kind of like a taxi line. The way they already had the tents out ready for triage, because the year before there was a heat wave and people were having heat strokes, so they were prepared that way, and they quickly shifted that into more of the triage to get and had it gauged to where you get the worst out first. You know, you mentioned that to people, and it really, that opens their eyes. I don't think they realize. And I said, you know, could you imagine if there wasn't training, if they weren't ready, if Massachusetts didn't have this system in place? I mean, granted, they are some of the best hospitals in the world. That set aside, they still were prepared. They still were ready. They had a plan in place. They got there quickly. They knew what to do. They knew where to take people. And so I said, you know, 20 years ago, you may have just a mass rush in and, you know, clog and then try to sort it out. So I say that the way it was just, you know, methodically done shows the training and shows how they were prepared. And, you know, I take that into account. I take into account the, you know, again, we like to highlight the ones that hit the news. So we, you know, of course, the Joplin tornado and how they were ready, not only moving patients out of the hospital was hit, but, you know, having neighboring states come in, knowing what beds were available throughout the state and other states to get people the care that they need. So I think it's these things that, again, they don't realize that are public health. And if that wasn't there, you know, what may be the outcome? So I think those are the things that really, I think, get people's attention, is the way, you know, public health silently kind of sweeps in. And that's the key. It's silent. Public health is silent every day, and they're ready to go. And just like law enforcement, just like first responders, and they don't get it. But I think the knowledge that public health is always there watching and waiting and ready, I think really gets their attention.
Great. Thanks, Chris. Does anybody else have any questions? Okay, we had a question here from Deborah. She says a few years ago there was talk of national workers' comp coverage for volunteers. Is that still on the radar anymore?
As far as what I have heard, and I have not, nothing has come up that I've seen this Congress, at least to federally mandate. I don't know if states are doing it on their own, but in terms of federal, I've not seen any federal legislation that. And typically, I mean, there are thousands of bills out there, but the ones that we kind of rise to the top and flag are those that are moving through committee, and I have not seen that on the federal side. I don't know about Andrea, the state side.
Yeah, we're not seeing a lot of activity in the states on that right now either.
Okay.
But it's a good thing to that's another good topic to bring up to folks.
Hey guys, this is Rob Tosato. We continually bring up the idea of workers' comp and liability protections as part of our legislative packages going up through HHS, but they haven't seen fit to get out of HHS, unfortunately.
Yeah, and I can see that. I think it's always such a unfortunately it shouldn't be such a touchy subject. I think eventually, maybe we'll get there. I mean, I've heard talk about it before, and then it dies quickly. But I think something big's going to have to happen before we move on it. Unfortunately, that's just, at least on the federal side, it's the reactionary process.
Andrea, did you see anything about that last question about workers' comp from the state level?
We're just not seeing a lot on that moving in the state either, unfortunately.
Okay. And we also had another question come in, and someone asked, can you speak to the advocacy efforts ASTHO has put forth to promote the MRC? I will say that working directly with at least our preparedness directors, we continue to promote the MRC to our preparedness directors. I know some of you all work very closely with your state preparedness directors, while some do not. So we continue to work with the preparedness director, trying to promote the great things that MRC units are doing. And we're always open to hearing stories and hearing of the great work that you all are doing and bringing you directly to the preparedness directors in a variety of means. So if there's anything particular that you would like as an MRC to promote to the preparedness directors and state health officials, we at ASTHO would be more than welcome to assist you in any way that we can. So moving forward, please, I'll send out my contact information. If there's anything that you want us to do, we would be more than happy to help. Do we have any more questions? Okay. Well, if we have no more questions, I do again want to thank everyone for joining us on today's webinar. It was short, I know, but I hope it was very informative to everyone here. And we will have the recording available so you can share this with others in your network. And we'll put it up on our website, and I can send it out on the coordinator listserv as well. So again, if there's no more questions, we do thank you guys for your time for joining us on today's webinar, and we look forward to having future webinars dedicated to MRC in the future. So thank you very much.